Good morning. Many of the patients that come to our office are coming for the first time with a complaint of their shoulder. This is a very common problem in orthopedic surgery, seen everywhere in the world. And I wanted to quickly review some of our approach to a patient initially coming with a shoulder complaint. First, I wanted to explain a little bit of the anatomy of a shoulder. You see from the drawing here, the shoulder itself has a number of muscles and tendons which surround it, and this is known as the rotator cuff muscles. The chief amongst this is this one on top called the supraspinatus, and frequently if there is a tear of the rotator cuff, that's the one that is torn. Now most people that come with a complaint of a shoulder feel they might have a rotator cuff tear because they've heard the word so many times, but they don't necessarily have that. Many times what they have is an irritative phenomena where the rotator cuff here is just being irritated by the bone above it, a condition known as impingement syndrome. So one of our approaches is to try and distinguish between what the person's real cause of pain is. And we start off initially by examining the patient. And we put the shoulder in various motions and determine which motion seems to be bringing about their complaint. Then we proceed with the diagnostic studies. Frequently I'll take a plain x-ray of the shoulder because it's important to know whether or not there's a significant amount of arthritis, and even in many cases sometimes there's a broken bone that people don't realize is the cause of their pain. After that, we'll many times try a course of physical therapy, and very frequently combined with an injection of the shoulder. That's usually a cortisone type preparation, but then other types of injections are utilized as well, even including platelet-rich plasma injections. And then, depending on that, usually I'll try these type of measures for maybe 3 or 4 weeks, see the patient back and determine, did these limited measures, such as some therapy and maybe an injection in the shoulder, take care of the problem, or do I need to investigate it more? If I do need to investigate it more, then most likely the next step is going to be a test called an MRI scan. Many times if people have a very severe complaint, then I will order an MRI scan right on the first visit. But if the complaint isn't too severe, I would usually try some simple measures first and see if that works out. In fact, I find many times that their insurance carriers want a couple simple measures tried first before proceeding with MRI scans. And in many cases that makes sense. In some cases it doesn't make sense. If it doesn't, then we'll tell them why it doesn't. If in fact a person has a more serious injury to the shoulder, such as a torn rotator cuff, it may require surgical care. What that entails is this tendon here, what we're calling the supraspinatus, if it's torn and retracted, what we do then is arthroscopically reattach the tendon. That's done at an outpatient surgical procedure, takes roughly an hour. Patient goes home the same day. The real issue though is that people will need a fair amount of therapy afterwards. The recovery from surgery to repair a rotator cuff tear, it easily goes on to maybe 2, maybe 3 months. And after that, usually people do quite well. And the biggest difference people will notice is in their sleep. One of the biggest complaints I hear with people with shoulder complaints is pain at night and pain with sleeping. And with all these various methods of addressing it, frequently we can take care of their problem. And one of the main questions I ask people down the road is, how are you sleeping? And usually you'll hear that they're sleeping much better now, and they're very glad they had it because now they can get a good night's sleep. So come in if your shoulder's hurting you. We'll try and figure out what's going on and try and help you out. Thank you.